Yeah, there was, and I should also mention in this context another organization. I say in the preface that I do the medical committee, but I'm also bringing in others. There was this marvelous organization called the Student Health Organizations, and I said, well, that was sort of the SNCC equivalent of MCHR, and it was to a certain degree. But they began in the mid-60s. One of the first things they did, they got government grants to go into barrios, to go into a lot of work being done in California. A lot of the clinics were in these areas. But what SHO activists were very concerned with was curricular reform in the medical schools, that family and community medicine was being ignored. When they were doing their internships, they would have no contact with the community at all. And some of the people like, well, one of my favorite sources was a guy named Fitzhugh Mullen, who is a leading historian of social medicine, a physician and an activist. He was in Holmes County, Mississippi in 1965. And he has a wonderful memoir, White Coat, Clenched Fist, that begins with his medical school training and takes him to Mississippi through his internship and ending up at the Lincoln Collective. Medical students really are interested in this story because what Mullen and others had decided, they came out of SHO, they had all this idealism, but then they get into mainstream hospitals and they would be overwhelmed. So somebody had the idea, let's all select a hospital, go there and take it over. And so they took one of the worst hospitals in the country, Lincoln Hospital in the Bronx. And of course you've got all these people from Yale and Stanford and Chicago medical schools saying, you know, we will do our internship here, or we will come as residents. And they were delighted. And of course what they tried to do when they got there was to turn the department into a people's collective that was run by patients and by doctors, and of course the authorities went ballistic. It was this kind of thing that sort of marked the high point of this creative radicalism. Yeah, they would study Marx and Mao at night, but unlike others, I mean, these people all day were dealing with life and death issues on the floor. I mean, this is what really impressed me. You know, they just weren't sitting around plotting the revolution. They had to put in their day's work and their night's work, and everything else was on top of that.
I know you are working with Jack Geiger and focusing on the Delta Health Center.
Yes, yes.
How does this connect with?
Okay, I'm glad you mentioned that because I've been talking about the health center for 2 days now, and I guess because I neglected to mention it. Probably the most important single contribution that came out of the Medical Committee for Human Rights was the Community Health Center movement. And this came out of the Civil Rights Movement, it came out of Mississippi. Jack Geiger was in that first group who went to Mississippi in '64, and he and Count Gibson, who was the only white Southerner in the initial contingent of MCHR, kept coming back to Mississippi. Geiger got money from a wealthy Washington couple to set up a health clinic in the Delta town of Mileston, which did good work but was very small. You also had an organization that hasn't been written about enough when it comes to the Mississippi movement, and that's the Delta Ministry. It was set up by the National Council of Churches. And it was this group, really, when SNCC left Mississippi, that provided so much assistance, particularly early on. I mean, they had money, they had resources, and one of the things they were really interested in was dealing with health care. So they were underwriting much of the MCHR budget for nurses and for Poussin's salary for the first year. And they called a meeting in the Delta in December in Greenville. And Geiger was there, and Bob Smith was there, and Count Gibson, a couple of people from the Delta Ministry. And they were talking about what to do. And it was at this point that Geiger remembered that in the 50s he had been in South Africa, of all places, and saw these model health centers, one in a rural area, one in an urban area, that combined everything. That it was not only pills and prescriptions, but it dealt with what is in recent years have been called the social determinants of health. So when they did settle in Mound Bayou, one of the first things they did was to go out into the countryside and fumigate shacks, put screens where there were no windows, build sanitary privies, conduct educational classes. All of these things to, and of course, one of the things that people were most concerned about was being hungry. They came at a time when conditions for many Delta blacks physically were worse than they had been in slavery. Quite literally, they were starving to death. And as this group of doctors who came in '67 found, you probably either remember or have seen pictures of Senator Robert Kennedy coming into some of these areas in the Delta. What had happened, of course, is that the sharecropping was no longer there. The cotton economy had been totally mechanized. You didn't need, you had tractors to plant cotton, you had pesticides to eliminate the chopping of cotton, and you had, of course, the cotton picking machines. So where before you had maybe 100 families on a plantation, now you needed 6 or 7 tractor drivers living in little brick houses, and that's all you needed. So you had this surplus population. They were, one of the doctors said that he felt it was the policy of Mississippi to starve people out. And it was this then that they had to deal with. So one of the first things that Jack Geiger did was, and he's very fond of telling his story, he tells it all the time because he tells it so well, that he started writing prescriptions for food. And when one Washington bureaucrat objected, Geiger shot back, "The last time we looked in the book, the prescribed therapy for malnutrition was food." But this, of course, you couldn't do forever. So there was an amazing, and a part of what made this health center movement unique was community organization. That came out of the movement too. And there was the person who worked most closely with Geiger, may have been even more responsible for the Mound Bayou Health Center's success, was John Hatch, who was Professor Emeritus at the School of Public Health here at UNC. And Hatch went out and organized families. They had a stake in it. They had a say in the decisions that affected them. In short, it was a model. And thanks to Ted Kennedy, who went to the Columbia Point Center, got $50 million right away to expand centers, that now you have over 1,000 centers across the country with about 5,000 sites providing good primary care in most cases for upwards of 20 million people. And I'll just close on this, that what is most interesting with all of the problems of the health care bill, and whatever happens, there is stuff in there that's really important. And the biggest supporter of health centers now is Bernie Sanders of Vermont. And he put into the Senate bill a provision to add $10 billion to establish new community health centers across the country. I just got back from Washington at the national meeting of the Community Health Center Association and watched as 1,000 people welcomed Jack Geiger and John Hatch talking about how all this got started. And they were very hopeful that if this bill comes out, that this movement that's been so important will get the boost it needs to do a lot more good in a lot more areas.